Hello, and thank you for joining me for the Healthy Enterprise podcast. If you've been here before, thanks for coming back. And if it's your first visit, I hope you enjoy this episode. I'm going to be talking to Jeff Petersen. He's a seasoned physical therapist with nearly 40 years of experience with a deep commitment to a whole person care. He founded his practice in '92 with a mission to help as many people as possible and has since grown it into a thriving clinic-based business with multiple locations across Arizona. He continues to treat patients and brings a unique perspective on blending clinical excellence with sustainable practical growth. Please welcome Jeff Petersen. So Jeff, welcome to this episode. Thank you for joining me today.
Yeah, thanks for having me.
Yeah, curious to learn more about what you've been doing. So why don't you start with that? Start with doing an introduction of yourself and your company.
Okay. Yeah, so I'm a physical therapist. I've been a physical therapist since 1984. Opened my own practice in 1981. Exclusively, although I've done some hospital and some nursing home work, it's exclusively outpatient orthopedics. And so 1984, that's 40 years ago. So medicine has changed a lot since I started practicing. Matter of fact, in 2020, I listened to the American Physical Therapy Association, the president give a keynote address at a conference I was at. And I was thinking, wow, I've worked through like 3/4 of the profession as a physical therapist, because physical therapy wasn't really recognized in 1968, 70, 75. So starting in the mid 70s, it started to emerge as a licensed profession. So I've done that. I practice exclusively manual therapy. I studied with a manual therapy is like joint manipulation, stretching. I studied with a Norwegian physical therapist in the 90s, Ola Grimsby. He was a big name in the profession at the time. And then I've just been working with patients throughout the years, and basically got interested. People come to see me because they have pain. So trying to figure out, okay, how do you help more people? And like I said, the profession has changed a lot. The principles and the fundamentals of practicing physical therapy have been tweaked a little bit, but interacting with individuals that are in pain has not changed a lot. It's changed for me because I've gotten better at it, but the principles have remained the same. Right. So that's me. We've got a company of 4 offices, 9 clinicians, and they all do an excellent job. We're in Tempe, Arizona, Maricopa, Arizona, and 2 in Mesa, Arizona.
I mean, but leading up to that, you were primarily an independent, right? Like most physical therapists just run their own clinic and they look after their own set of patients.
Yes. Although it's interesting, when I started practicing, that was not the case.
Oh, really?
Yeah, most therapists worked in hospitals.
Oh, is that
so
right?
PT came.
That's where that started.
Yeah,
okay.
It came about basically through the military, restorative nurses after World War I and II. And during the polio pandemic, the restorative nurses started doing more and more, and then finally they started getting certified and peeling them off and saying, okay, you're going to strictly deal with physical therapy. So when I became a private practitioner, there weren't that many. And now it's mostly private practice or hospitals or skilled nursing facilities, some home health.
And so how many locations again?
We have 4. Yep.
4. So what made you think to expand like that? Like that, not everybody does that either, where you have multiple locations and multiple practitioners. Yeah. So what inspired you to do that?
Well, I think it didn't inspire me, but it explains it. There's a book called The E-Myth Revisited.
Yeah.
It talks about the entrepreneurial spasm. And I think just a young man's arrogance, I could do this. I can do this better than anybody, So a lot of it was just sheer, where I come from, they use the term chutzpah. Just trying to get out there and think that I could do it. And so nothing more than that.
Well, you said earlier a little bit about how many people can I help?
Yeah.
right? So you are limited as an individual. You personally can only help so many people. But if you have multiple locations and multiple
Yeah.
practitioners, then you're
So that does.
conceivably you're replicating yourself to a certain
Yes.
extent.
Yes. And that's the idea. And that's one of the biggest challenges, honestly. But you're right. We can only help, a certain number of people in a day. One of the things that we talk about at our company is the number of people you can help in a day. Really, one of the limiting factors is the skill of the therapist
Mm,
to be able to get in, understand what's going on, connect with the patient, not rush the process, but get to the salient point to be able to help that person as efficiently as you can.
hmm
And sometimes that takes more time than others, but being able to triage people and know, okay, where am I most necessary? So that's really what I'm doing now as an older therapist, is trying to help therapists do that, because, reimbursements are down and costs are up, and, healthcare is in demand. I think the number was only 20% of the people who could benefit from physical therapy actually seek out care.
mm,
And we still haven't quite hit the bump, the peak of the baby boomer generation.
yeah.
I'm the tail end of it, maybe a couple of years below me. So,
hmm
we're in our 60s and 70s when that's when a lot of care is necessary. So, we
And who,
prepare.
when people seek out a therapist, I mean, how do they? Is it usually some sort of it's typical? Is some sort of injury or some sort of trauma that really triggers that sort of connection, and you get a referral from your
Yeah,
doctor or
yeah,
something like that?
yeah. Either an injury. So we see a lot of people with acute injuries. We see a lot of people with chronic pain. We see a lot of people that have pain that haven't had pain before. Pain is really probably the primary factor that drives people to go seek
hmm
care. Like I've
hmm
never, the facet joints in your spine can get stiff. One of them might get stiff and cause pain on the other side, but no one's ever come in and said, I have a C5 facet joint that's stuck. I can't quite turn my head, or I can't rotate my spine to get a full drive when I golf. Can you help me?
Right.
Occasionally we get that, but most of what drives people, and not just into our office, but into healthcare, is
Right.
the existence of pain.
Yeah, or the absence of mobility too,
Yes.
right? Like you said, like I can't do
Yeah,
my
but
golf
that's
swing like I
that's
used
that's
to.
still rare. The absence of mobility, when people get to the point where they start falling, that's when people will come in to the office.
Oh, it's almost too far. They've already kind of moved past that.
Absolutely. For the vast majority of cases, there are some people
Yeah.
that have a higher level of awareness.
Yeah.
But sports performance is not usually, or any performance is not usually what drives people into medical care. It's usually because they have pain in an area.
Right.
So we want to try to change that, and that's why I shared with you last time. I'm actually in the process of writing a book on pain, so that
Yeah,
we
that's right. So
can
tell us about that.
reframe that whole
Yeah.
concept. Well, so as a young therapist, you get in and you're helping people, and they have pain, and they come to you, and we want to help them get rid of their pain. And what I noticed over the years is that people who didn't get better in the profession, this is decades ago, the tendency was to blame the patient.
Hmm.
You see that with surgeons. They do the
Right.
surgery, it doesn't go out well. Well, the patient must have screwed up, or the therapist must have messed up the surgery. Um, and there was, and people who are in pain, chronic pain particularly, is kind of the unspoken, untalked about kind of tragedy that's out there. Nobody wants to really hear about your pain, and people don't know how to talk about the pain or frame the pain, or sometimes people will over focus on pain. And
Right.
so it got me doing research and studying, and I was searching for the magic bullet. I studied manual therapy, thinking, okay, if we could do some manipulation of the spine, that's going to be the magic bullet for back pain. And it wasn't. And then came to realize I was doing some research on pain, and stumbled upon the definition of pain put out by the International Association for the Study of Pain. So these are the guys who do nothing but study pain. The
Just
PhDs,
pain all day.
that's their gig. That's what they're into. And they define pain as an unpleasant sensory or emotional experience.
Oh,
So that was the first
okay.
part that caught me. And then it goes on to
Yeah.
say associated with the sensory changes or active or potential tissue damage.
Mm.
So the takeaway for me was, one, that it is is largely an emotional experience. It's an
Right.
emotional response. It's like laughing. You know, you and your significant other go see a movie. I suspect one of you is going to laugh, might laugh at it, and the other one is confused by it. You know, when you're with a
Right.
buddy or with my wife, I'll laugh at something. So that same stimulus evokes a different response.
Right.
And so it really it's an emotional response, much like laughing. It depends on kind of how well rested you are. You know, if I sprain my ankle, or I mean, I did it. I went fishing and I caught a hook in my finger and I had just a little bit of a cut, but then I got infected. And, you know, I was on vacation, didn't bother me. I'm like, yeah, it's a little bit of a nick.
Inconvenience.
Then
Yeah.
then I come back to work, and every time I wash my hands, it's like this, you know, so different scenario, different setup. Now my response to the same stimulus is different.
Right.
So it really is an emotional response that can be influenced by your nutrition, your rest, your fitness level, your mindset around pain. An example that I like to give patients is, Heath, if you and I are talking and I'm a physician and you come in and you ask me for a vitamin B12 injection, and I take that needle, and it's a beveled needle with a sharp edge, and I penetrate your tissue, damage your skin and your thigh, and inject the vitamin B12, pull it out, little bit of spot of blood, and you go on your way. You'll have a little bit of soreness. Now, if we're sitting there talking, and as a practical joke, I take out the same exact needle and penetrate you in the same exact spot in the thigh, creating the same exact damage, and then I start laughing and mocking you because I've now created this cruel practical joke and I've victimized you, your
Right.
tissue is going to react completely differently. Even though the
Oh,
local damage is exactly the same, the emotional
really?
experience is completely different. And so being able to at least have some measure of
Really?
appreciation for that
Huh.
is really important to be able to reframe what I'm experiencing. The other thing that I've learned over the years is that the intensity of the pain is not always correlated with the severity of the problem. You know, you would think as humans, and we want to survive, that things that threaten our lives are the most severe problems, and things that threaten our comfort are, you know, they're problems, but they're not as severe as things that are going to kill you. When I treat a patient that has a herniated disc in their lumbar or cervical spine, and it's irritating a nerve root, that is the most miserable pain one can experience. And people want to die, but it won't kill you. You can live for decades with a herniated disc, compressing a nerve root, irritating that nerve root, and causing sharp pain down your leg. Pancreatic cancer and brain cancer rarely hurt, but those things will
Right.
kill you.
Right.
So it's like, you know, the
Yeah. Very
severity of
interesting.
the problem is not necessarily correlated with the intensity of the pain. And so being able to help people appreciate that and say, appreciate the experience. Pain is an experience that we
Right.
have. It's and the experience is influenced by so many factors in our life.
And you know, when pain happens, is it what is it? Is it the body trying to tell us that, oh, we've done something wrong? Oh, take a look at your ankle, or stop walking on your ankle. Or like, what is the
Yeah, absolutely.
body's what is it doing? Is it just a signal? It's just information, right?
Well, kind of completely morally neutral. It's simply information being transmitted by a specific set of receptors. If I step on a nail, you know, we have what's called mechanoreceptors in our body. So if you close your eyes, you could tell how many degrees of elbow flexion you're in. You can feel your elbow flex to about 90
Mm,
or 100 degrees without looking at it.
right. Right.
Pain, we're not as specifically wired, but there are what's called nociceptive mechanoreceptors, and they're designed to respond to pressure, chemical changes, tissue damage. So if I damage my tissue in my foot, it's going to send a signal up those peripheral nerves, which are outside the nerve, outside the spinal cord and outside the brain. Those nociceptive mechanoreceptors immediately send a message up to your spinal cord, which sometimes may create a reflex. So you
Right.
step on a nail, and immediately, without thinking about it, your foot retracts.
Pull it off.
Yeah, because
Right.
that's because the message goes to your spinal cord, across your spinal cord to your motor system, and then it immediately fires and you lift your foot. Then it goes up to, crosses the spinal cord, goes up to your brain, and then your brain has to perceive, well, what's going on?
Right.
Did I get stung? Did I step on something? Is there blood? Can I move it? And that's when, the higher.
Is my life in danger?
Yes, totally.
Yeah.
But
it's like survival
yes.
mode, right?
Well, and you've heard of phantom pain.
Yeah.
Phantom limb pain. So what happens is those pathways are so efficient, even in the absence of a limb, your brain is still processing that same pathway as, well, it must be that gangrene I had in my foot. And you have to kind of override that.
Right.
So it's more of a teaching tool than it is a warning system. People.
And then neurologically too, my understanding is that neurologically our brains will actually restore that information attached to the emotional experience, so that if we encounter that scenario again, we have enough information to avoid stepping on that nail or walking past that grizzly cave or whatever it is. It's like
that's the ideal scene. So in the ideal scene, it becomes a learning tool.
Yeah.
But you'd be surprised at how many people miss the message. Yeah. Seriously.
Actually, I don't think I'd be surprised.
Seriously. And that's part of what I do, is try to create a higher level of what I call kinesthetic, or awareness of your body and awareness of your person, without going too far, where there are some people that are hyper focused on self. But you want to have a certain amount of awareness, so that when you have that experience, because the other thing that can happen is, if you repeatedly have that experience, those pathways become so efficient, they begin to reinforce themselves. And so it takes less, and we see this with emotional pain. So emotional pain and physical pain, I kind of use those terms interchangeably.
Yeah.
But what happens is you reinforce those painful scenarios with a less of a trigger, because those pain pathways have become so efficient. And there are ways to make them less efficient by overriding them with motor pathways or other sensory stimulus to compensate for the efficiency of a continually painful pain pathway.
It's interesting that you make this connection, because we're probably just as adverse to emotional pain as we are to physical pain, and maybe in some cases we're more adverse to avoiding emotional pain.
Yeah, it can
right?
be. Yeah.
We'd almost rather have physical pain than emotional pain.
Yeah, and that's an interesting observation. I don't know, like, the numbers. I know that we see people that, I mean, you've had a conversation with someone who is just ready to argue with you.
Yeah.
They just, whatever it is, it's because you have a goatee and they're triggered by something and they're ready.
Right. You voted the wrong way.
Yeah, so they're emotionally defensive. But there are people who are tactilely defensive.
For sure, yeah.
And I see that all the time when I go in and I move in, I try to touch someone and they're like, okay, don't be touching me. And some of that is neurological. There are these receptors called mu receptors that some people that help transmit pain. There are some people that have a higher number of those receptors in their body. So there are people that physiologically are more sensitive. And I suspect it's true of the emotional side. There are some people that emotionally are, that's how their brains are wired, or it's how their brains grew.
Yeah, I've learned from a few books I've read about that. Really, the human body we have 5 senses. We have touch, smell, sight, sound, taste, and that's the only way we receive information. And then the information is then computed by our brain and stored and made sense of.
Yeah, absolutely.
What's a threat? What's not a threat? I mean, it's all about survival.
Yes.
What is going to endanger us from reproducing as an organism, and how are we going to get to that point, to that end line? And so, that is the only way that our actual our bodies can determine where we're at and what environments are suitable for us to thrive in, as opposed to.
I've often said our bodies are basically transport systems for our brain.
Yeah.
So we're moving
Yeah.
throughout the system. And what's interesting is it's incredibly complex, but just unbelievably simple. The nerves are classified into two different categories: the nerves that bring sensation to the brain, or the nerves that bring messages to target organs and muscles.
Mm.
And that's it.
Hmm.
And then all the other stuff happens in the brain with the interpretation of it. And so you're right. The idea is we bring our brains throughout the system and to experience the world, and we're going to just interpret what happens. And the idea is to try to keep ourselves safe so that we can't reproduce them. And I think at a higher level, because we're not just animals, at a higher level is to not only live and survive, but also to participate and to produce and to somehow be creative to contribute to the world.
Yeah. Yeah, absolutely. And share our knowledge, share our experiences so that
Absolutely.
for the good of the entire
Yes,
species, right? It's like we share that information so that we as a as a species can actually grow and evolve, and how we got to where we are today,
absolutely. Yeah, life is a
sharing
team
all that
sport.
information. Yeah, exactly, exactly. So this book, you're in the middle of the book now. Are you
Yes.
close to the end? Where are you? Where are you
January,
at?
probably January. I'm in the middle of the creative
Nice.
phase and getting stuff down on paper. And basically, I'm trying to take the conversation that I've had with tens of thousands of individuals in the last 40 years
Hmm.
and say, okay, what is it that I would want? What is it that I want a patient to understand? And even in
Mm-hmm.
the midst of having that conversation, I appreciate that it can be overwhelming when you're in the midst of experiencing a painful
Mm-hmm.
a painful condition. It becomes everything.
All consuming.
No matter what your
Yeah.
day, no matter what you have planned for your day, if you herniate a disc and it compresses a nerve going down the leg and irritates it, or it makes it numb so your foot drops, full stop, that's what you're focused on.
Yeah.
So that's where the quality of life issue is, to be able to help people kind of anticipate stuff if we can get sensitive before the injury happens. So a lot of the injuries happen because of decisions that we make,
Mm-hmm.
you know, and activities that we're involved in. Like I said, fishing. I'm not a very good fly fisherman. I spend more time fumbling with the line, trying not to fall in the water, catching the the fly in my hand and hooking my hand. And, where I a better fly fisherman, would I have cut my finger? Absolutely not. Absolutely not.
Right.
But in that case, I say, cost benefit analysis. This is worth it. It'll get better.
Or had I not been distracted in my mind on thinking about something else while I was trying to do something like using a table saw, or or walking on on an even pathway, but I'm so distracted because I'm not really in the moment paying attention, and I
Absolutely.
twist my ankle, and now I'm mad at myself because now I twist my ankle. Now I can't actually do the run I was supposed to do on
Yeah,
Saturday. So now
absolutely.
I'm pissed off. Like it's just a rabbit hole.
Yes, absolutely. Absolutely. So, and what happens is sometimes people, what you just said was really important, is that you get pissed off at yourself. So
Yeah.
now you're heaping shame and guilt on yourself.
Yeah.
So it's the fine line between taking responsibility without shaming yourself.
Mm-hmm.
And that is a really difficult place for most people to get to.
Yeah.
It's easy to beat
Yeah.
yourself up. I'm like, dang, I was so stupid. Why did I do that? Well, that's
Idiot.
the second
Yeah.
time I've done that. If it's the second or third time, then you really can heap.
When will I learn?
Yes. Well, and that shame prevents learning.
Yeah.
Shame always prevents learning because it feeds into the pain. So you don't want to shame yourself. So you start to go into denial and you don't want to look at it. And the first step
Ooh,
is to know yourself and do it without shame.
this is interesting. This is cool. This can be so you're calling the book Pain?
The tentative title right now is In the Shadow of Pain.
In the Shadow of Pain.
Yes.
Ooh, I like that too.
Yeah.
That's good. So has this been brewing for a while, this book?
I think the ideas have been for 40 years. For
Mm-hmm.
40 years, you kind of I've developed a narrative of how I learned early on when I was practicing physical therapy. Someone said, get grounded in a philosophy. Then you have a foundation from which you can spring and learn other things. but gets
Mm-hmm.
grounded in a foundational philosophy. So the foundational philosophy I was grounded in is the Norwegian Manual Therapy School. And they do a lot of manipulation, joint manipulation, muscle stretching, and exercise in Norway because of how they are reimbursed, or they used to 40 years ago. And so they were kind of pioneers in the manual therapy field, and so I was grounded in that. But that's where I started to learn about pain and the physiology of pain and the emotion of pain. And then from there to be able to say, okay, there are other techniques and there are more things. So that was kind of the beginning. And it always came back to people come to see me when I'm at a party or I meet someone new. They, oh, you're a physical therapist, and they always apologize, but I love talking about it. The challenge is sometimes they want the quick answer, not the full answer. So that's where the book came out. So I want to be able to give the full answer from the foundational science to what my perception is. It's not an academic treatise, but it does involve some references for the science behind what I'm talking about.
Mm-hmm.
And then I
Yeah,
just
there's
add,
a lot of science in there.
yeah, and to the end of it is, the truth is, if you think about it, science, medicine, religion, and magic were all kind of the same things 300, 400 years ago.
Yeah.
The medicine man was the magi, and the
Yeah.
priest was the healer, and
Yeah.
it was all kind of the same things. We read a book, Stiff, talking about the beginning of the study of anatomy and how they used to rob graves and pay guys to go in and dig up fresh graves and hang out the executions just so that they could, and these guys were considered really freaky. Yeah,
Yeah.
they were the beginning of studying anatomy. Yeah,
Cadavers.
scratched up a
Yeah.
lot. Socrates, who was, the father of modern medicine, the Hippocratic Oath. He thought the brain was just an organ that secreted hormones, and that's how it influenced. And the whole discussion of where does the soul lie? Is it in the brain? Is it in the heart?
Heart. Yeah, exactly.
There were times they thought it was in the liver for many years, just because you look at the liver and it kind of looks like this cool spaceship. And
Yeah.
they thought, man, anything shaped like that has to be the center of our soul, because just look how cool it is.
And some think the amygdala
Yes.
because it
Yes.
looks like the Eye of Fatima, or
Yes. So,
I think the Egyptians came up with that one because they used to entomb, do the mummification
yeah,
process, and
they
they
pull
went
the
through.
organs out except for that one.
Yeah, it's
Yeah. So
crazy.
it's, so all that stuff's been
Yeah,
blended.
yeah,
And then at some point we decided, well, it's all very separate. But the truth is, we are, we're not 57 Chevys. We're
yeah.
humans and the brain is an
Complicated.
amazing thing. It doesn't secrete hormones necessarily, but it is an incredible, uh, it's an incredible organ that
It tells
does a lot.
which organ to secrete which hormones, though,
Absolutely. It kind of
right? Like
directs the
it's part of
show.
the yeah,
Yeah, it
yeah,
directs the show. And so then you start dealing with pain. And like I said, there's a lot of things that can influence not necessarily the physical damage or the physiological damage, but our response to it.
mm-hmm.
That's really the crux of the book, is get to the point was, how are you responding to the pain that you're experiencing? And are there responses that can at least optimize your environment so that you're not suffering?
Right.
And then the other bottom line of it is, even if you can't eliminate the suffering, can one find purpose in the suffering? I watched my wife deliver both of our babies, and oh my goodness, I was so impressed. She was just tough
Yeah,
as nails, man. And I
yeah.
know it must have hurt, but there was a purpose in that. That was not needless suffering.
No.
So that's the part that I'm wrestling with in terms of how to articulate that without getting preachy and without dismissing one's experience. But I have found, even in my own life, if you can find some measure of purpose, it helps the endurance of pain. Um, it just helps.
Well, I mean, without pain is it's the contrast that provides us, I don't know, the baseline of when we're not in pain.
Yeah, absolutely.
If we don't know what actually pain feels like, if we don't feel sad when someone dies, when we don't feel something when we, slam our hand in the door, then we can't actually appreciate when we're not in pain.
Absolutely.
And so a lot of that has to do with just so knowing and being in, when you are in a moment where you are pain free, is
There's an
recognizing it and going,
appreciation for it.
look, look at me right now. This is
Right.
awesome.
Well, one of the
I'm
books I just got through reading was a story of a guy who worked with leprosy patients. And one of the characteristics of that disease is they lack the nociceptive mechanoreceptors. So they don't feel pain. So he describes a story of working with a little girl who destroyed her ankle because she just kept walking on it. And when she was a little kid, would bite the tips of her fingers off, and she just didn't feel any
wow.
pain. And it's hard to
Wow.
correct a child like
Wow.
that because there are no real physical consequences. So you have to
No.
appeal to a little 3-year-old's sense of morality. Which do you have children?
Yeah.
Yeah, and when they were
Yeah,
3,
too.
the sense of morality is questionable.
Oh, yeah.
They're pretty self-centered little beings, So you're trying to appeal to that because she wasn't feeling any pain. So that was a big issue in treating leprosy patients.
Wow.
And what they found
Very
was that
interesting.
they could repair a joint that had been damaged. So only certain cells, certain areas of the body were susceptible. They noticed,
Right.
and so then they thought, okay, well, once the disease works its course and it's stable, we could repair the joint and do tendon transfers so that we can restore some function.
Mm-hmm.
And then the challenge was they still didn't have the awareness to be able to protect the area. So
Wow.
it became a challenge. So it really is
Very interesting.
necessary for our own
Yeah.
self-protection to teach us what are the guardrails in which we can live safely.
That's right.
And
Yeah, that
how
makes
do we
sense.
spread them out? You don't want to live in a cocoon. So that's really the challenge: is how do you spread out those guardrails, but you still keep them within the boundaries of safety, and you're not going to damage yourself.
Or kill myself.
Yeah,
How much damage can I do without
yeah.
killing myself?
And we know, I have a buddy who's like that.
Bull
We all
riding,
know someone,
for example.
yes, who their sense of personal risk is just way higher than.
Yeah.
Yeah, I grew
Yeah.
up. I was raised with 5 brothers, and there were 4 of us about the same age, and I was always the sensitive one. So I was always the one who ended up crying, which my wife.
Right.
But, there was a sense of the big, strong, athletic guy who has no sense of personal safety is ready to go out there and do it.
Yeah.
You know,
Fight or whatever, whatever varying degree of extremity they decide to go
yeah,
for.
absolutely.
Well, that's exciting. That's I'll be looking for that book.
Okay,
So you'll keep me posted
I
when
will
that comes
absolutely,
out, right?
absolutely.
Yeah, for sure. Yeah, we'll have to make sure we share it too. Let's change lanes for a minute. I want to come back to when the day you or the time when you decided to expand your business and grow it from not just Jeff working on his clients, but adding multiple people in multiple locations
Okay.
and can maybe some of the, like you said earlier, that the biggest challenge for you was replicating yourself or replicating your systems. Is tell me, where did you how did you start that, and what did you find were the biggest challenges in
Yeah, that's a good question.
replicating what you
So the
started?
start happened where I just had that entrepreneurial spasm. Well, if we can do it here, we can open an office here. So I've opened and closed 12 different offices.
Oh, wow.
So I tend to learn from the school of hard knocks, you
Sure.
know. Um, and
It's the
then
best school there is.
so the greatest challenge was if I were to place a therapist in another office, I just thought, well, they're going to work. They're going to do like I would do, and the idea of offsite management and connecting and building a culture where they're getting the support they need was just not even on my radar.
Right.
And then just realizing, okay, life is a team sport. I need a coach. So I've hired different coaches throughout the years.
Okay,
Probably
cool.
had 4 major coaches where I've
Mm-hmm.
invested time and money and listened to them and
Yeah.
realized that what was missing is you can't just play. What was missing in the short version is I did not know how to build a culture around what was important, around what I thought were important values for our company.
Right.
And so that's the short answer, but it took a long
Hmm.
time to kind of crystallize that and realize
Make that
that
connection.
it really is about selecting people that have a connection, that, okay, we have some affinity in terms of what we're thinking, in terms of how to interact with people, how to be productive, how to take responsibility, how to communicate, uh, and then giving them what they need to be able to see more patients,
Hmm.
because we get busier. And so how do you, most young therapists have a challenge. They start to feel bad because they don't think they're helping people. And
Right.
so, and nobody wants that. If so if they don't, it's a lot easier to say, well, I'm too busy, as opposed to, okay, let's sit back and can we organize our day a little bit better? Can we organize our patient load a little bit better? And can we
Hmm.
organize our thinking when we're interacting with people so that we're more efficient at listening, identifying what their goals are, helping them appreciate if they're uh, appropriate, and gently educating, and then helping them do the work so that they can get better. And so getting to that point took several failed attempts.
Hmm.
And then lastly, to be able to say, okay, how do you tie that to the financial side?
Right.
We're really, our business is high touch, labor intensive. I've been interested to see how AI might help us, and I feel like we're in the beta version, literally the Betamax versus VCR time. Are you old enough to remember that? And if
Yes.
you were
Of
unfortunate enough to
course.
buy Betamax and beta tapes, all of a sudden one year you looked up and said, "Oh man, I can't get any more. I can't even rent them." Um, my sense with AI is that's where we're at. That it's still kind of early stages, but it's exciting. But it'll still be very high touch. So getting to the point where focusing on that culture, and then including part of that culture is we don't do it. Whenever I've made a decision based upon purely financial reasons in my business, it's always bitten me in the rear end,
Yeah.
without
Yeah.
exception,
Yeah.
without exception.
Yeah.
And so to be able to say, okay, but we do, if we have this machine, this Petersen physical therapy machine, it's like a really nice car, and the finances are the fuel in the car. So we need the fuel to be able to drive the car and have our lives. So being able to make that connection, I think I've made better in the last 10 years than I had early in my career. Because I can also be driven by numbers to say, okay, we need to
Hmm.
get the outcome. We need to get the outcome. Let's get the outcome. And really push for the outcome. And I've learned, well, it really is about engaging in the process that will give us the outcome. Don't worry so much about the outcome. Worry about engaging the process, whether that's the finances of the company, whether that's helping someone get strong, whether that's helping someone get out of pain. It really, my focus has been, it drives my wife crazy. She's like, enough with the process. As a matter of fact, my daughter once said that to me when she was about 9. Dad, enough with the process. Enough. I'm tired of hearing about the process. Because uh, early on I learned
That's funny.
there's a difference between content and process.
Yeah.
And I've tried to live by the philosophy that it's the process that fails, not the individual. So if we don't get the outcome we want, let's review the game films. What process did we engage in? How well did we execute each step? Did we miss a step? Were we wrong on what a step was? And just look at the process. And since we've been doing that, we have, I have teammates that have been working with me 20 years, 18 years, 15 years.
Really. Wow.
And you get that kind of stability and trust.
Yeah.
And it just makes it fun.
So that would be your kind of number one thing. If someone was thinking about right now, I'd like to open another location or add more team members, and that would be your number one advice is get your process in
Get
line.
the processes down. If you can get them documented, making sure that they appreciate the need for culture.
That's probably where your AI could fit in.
Yes, to organize the processes.
Yeah.
Yeah, someone's, part of writing a book is you do a mind map and you get all the ideas you want to put in the book. And then I wrote up my table of contents. And just last week, someone said, you can plug that into AR and it will give you the. I'm like, okay, well, I just spent 7 hours doing it.
Well, now you can put it in there and it'll tell you if you did
Yeah,
it
at least
right
it
or
can
not.
correct the spelling. Um, but yeah, making sure you have the processes down. And in physical therapy, the processes are not vast. Now the challenge is we have multiple customers. So having business coaches, one of the things I've learned is I've had coaches that are in other traditional businesses. So they have a product, they have a client, they have a supplier. The challenge we have is our supplier or our referral source doesn't experience the service or pay for it.
Right.
The person only pays for a portion of the service, but we have to listen to the insurance company because they're paying for it. So they're influencing the service. So we really have to be responsive to the referral source, the patient, the insurance company.
Right.
Balance those oftentimes competing priorities so that we can do a good service and get paid for it. But that's the most complex part of it. But the processes of doing all that, it's people call in to make an appointment. Are they received efficiently? Do we collect the information we need efficiently without having it be laborious to the patient? Are we friendly? They get in, they get seen. Do they reach their goals? Do we document everything so it's appropriate so that we can bill it out and get paid? Of course, those rules tend to change over time. And that's an area where AI has been helpful. And then do we follow up and make sure what we call a paid up completion? Someone's got the service and they've completely paid their bill and they're happy with their service and they would refer someone else to us. And so we do get we've been around long enough that, I see patients that off and on that I've seen for 30 years.
Really? Wow. Amazing. And that's not, physical therapy, you wouldn't think that's a ongoing return client system. It's almost like
it certainly can be because
pain begun, pain begun. So am I,
Totally.
Interesting. So then I guess you can, building that sort of ongoing, is that sort of helping someone understand the benefits of having a proactive health plan, like if they have ongoing or chronic pain or things like that? Is that kind of what you try to do too?
Yeah, I think what creates the return clients more so is they appreciate the value of, try not to move around too much, appreciate the value of having a coach, a support system.
Right.
Someone who's empathetic. And they get through it. And, because anyone could look up online what exercises to do for shoulder pain. And some people do that and do well.
Yeah. Yeah.
But many people need, because of
that connection,
because pain is an emotional and sensory
that's what that comes back to.
People,
they need the emotional support as well as
they need to be heard and listened to and seen. Do you understand? And I've heard the descriptions of shoulder
because the spouse is going, yeah, I know. I hear you complain about it all the time. Go do something about it.
So I always coach patients, you should find someone to talk to about your pain, but don't include your spouse.
Yes, anybody.
Yes, and you have to also be careful. My wife experiences hip pain off and on. She's into pickleball, and you share with your girlfriends, and of course they all say, "Well, you need a hip replacement." So it's always good to have someone who has.
That's super popular right now. Everyone's getting.
Yeah, get one. I got one. And
they'll outlive you.
Yeah, they're great surgeries, but whether it's dental work, heart surgery, orthopedic surgery, replacement parts are never as good as the original health.
Yeah.
Now, once a part becomes so unhealthy that it needs to be replaced, then I'm all for it and people do well.
Sure.
But that's where you need a level of expertise to say, but what many of the physicians respond to is, well, she keeps coming in complaining of hip pain. Okay, well, doctors do not want you to be complaining of pain. I could find somebody to do surgery on my elbow today if I complain to enough doctors that my elbow hurts.
Yeah.
And they'll say, okay, let's go in and see what we can do. And I think they're very helpful. The really good surgeons know how to select their patients so that they get really good outcomes.
Right.
And so that's something that we've been doing more and more as I've gotten older and I've got gray hair. People will come in and say, what do you think? And so with my wife, we got her on an exercise program, did some dry needling, and, it still hurts if she has some, helping her see, okay, well, what did you do yesterday? Well, I hadn't hiked in about 2 months and I went for a hike. Okay. Can you see that this is a short-term pain. You're going to get through it. Get back on your exercise. We'll see how you feel in 3 days. And sure enough, she feels better. So being able to help people make those health decisions is something that I have kind of found myself fallen into over the years, because we do have people coming back and say, well, what do you think of this? What do you think of that? And I'm always happy to do that, because
there's some trust there then.
Yeah.
They trust your judgment. And
and I've got 40 years of experience working with people. So you can see, there are a couple times I've looked at someone and say, yeah, you really need a hip replacement.
You're like a sage now.
Yeah. Say again?
You're like a sage.
Like a sage, yeah. I think my wife,
healer.
when I come home from work, she might want to burn some sage, because it's really hot here in Arizona. But
So I had another question for you, and I had to go back to the spot. So you have ongoing clients, and so some of therapists, they hone in on a certain type of therapy, like sports therapy or performance therapy or something like that. You kind of sound like you stayed fairly general as to an area, and didn't go into a specific area. But how did you find clients? How do clients find you? I mean, in '84 we were using the yellow pages. But
yes.
Now what are you doing?
Yeah, that's interesting. Yeah, because we used to have a yellow page ad.
That's all we needed in those days.
And one of the big things was,
you need AAA physiotherapy.
Well, I was just going to say, one of the things was, you got to get those A's in there. You have to have a name.
AMA or AAA, AAA.
Totally. And those were not inexpensive. Back in the day, in '92, it was like $1,200 a month for like a little quarter-page ad.
Yeah, that's it.
Yeah, so I mean, I started out honestly by just picking up the phone and calling doctors and saying, you know what, I'm sitting here and I am a physical therapist, and why don't you send me your worst patients, the ones that I actually called physicians that had their own physical therapist.
Is that right? Cold calling physicians?
Yeah, and just said, listen, will you send me your patients that you don't want to deal with because they were just a pain? And so then
so you're also relieving their pain.
Yes, absolutely. Say, give me your challenging patients.
That's hilarious. Yeah.
And ultimately I developed the philosophy, or the promise: with unconditional positive regard, we meet our patients where they are. We don't judge anyone for being in pain. I don't accept when people come in and say, I'm sorry, because don't be sorry. We're not judging you. And we meet them where they are and help them move forward. Because what I've learned, if you can move one step forward, then you can take two, then you might take three. So we developed that philosophy. And of course, nowadays it's stuff like this, doing YouTube videos on exercises. We still do visits to physicians' offices, but sending out an email to each of our patients to say, if you have shoulder pain, here are some exercises, so trying to contribute some information to them.
Education. Yeah.
And let them know that we're still here if you have more questions. So a lot of online marketing, a lot of YouTube marketing, and then we still have someone who goes out and visits physicians to say, hey, we're still here.
On the beating the path.
Yes.
On foot.
Yeah, and our practice has gotten to a point where you build up a certain momentum, and then it's a matter of keeping it going as opposed to starting. I was talking to one therapist, and she was struggling a little bit, private practitioner, and I've been there where she was, where you just feel so discouraged because you're engaging the process, but you're not getting the outcome. Right. And then to step back and remember, it's a lot easier to increase or improve my production 5 or 6% at the place I'm at than it was to get started.
Yeah.
The process doesn't change. It's just a matter of saying, okay, what steps have I neglected and what do I need to get back to?
Back to the process.
Yes, back to the process. And the best thing we can do for our marketing is just to really treat our patients well, so that when they leave, they will refer other patients to us.
That's the gold. Yeah, for sure. And you're definitely in that category where people are telling other people, I have pain and now it's gone. And that guy did it. Jeff did it. Jeff fixed me. It's a great.
Yeah. Or the team. I try to emphasize the team too.
Yeah.
So
the Jeff team.
Yeah. Cool.
That's awesome. This has been great. Jeff, really appreciate you sharing with me your experience and your journey. And I think your book's going to be great.
Awesome.
I'm looking forward to it.
Yeah, I'll let you know.
If people want to reach out to you, what's the best place to get more information about your clinics? And then maybe,
Petersen, all E's, PT.com.
okay. And anyone wants to connect with you,
You
LinkedIn?
can go right there. Yep, LinkedIn or even our Facebook.
Or through the website.
Yep.
Awesome. Anything we didn't cover you want to mention?
No, we can.
Before we say goodbye.
We can talk about. I could tell you stories forever. I'm an old guy. No, not many people listen to us old guys. So when you get a captive audience, it's like, yeah, let's keep going on and on. I appreciate your time.
I can relate.
I appreciate your time.
Yeah,
you're doing
me
a
too.
good job with your podcast too. Keep it up.
Right on, man. Thank you so much.
You're welcome.
All right. Take care. Well, that's a wrap for another episode and my conversation with Jeff Petersen. One thing is clear. Healing is not just physical. It's emotional, it's personal, and it takes a whole person approach. Jeff's passion for patient care and the way he's built his clinic-led practice grounded in empathy and growth is truly inspiring. I'm definitely going to be keeping an eye out for Jeff's upcoming book, In the Shadow of Pain, set to release early next year. Please reach out to Jeff if you would like to connect with him, and you can visit his website. The link is below. And if you're in pain, please get the support you need. And I truly hope you find a path to healing that works for you. Thank you for tuning into the Healthy Enterprise podcast. We'll be back soon with more stories and insights. So please subscribe and share. And until next time, take care and stay healthy.